Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. It's good to have you. We're super excited because we're having some excellent conversations with real leaders that are painstakingly reshaping the future of healthcare. So we're really passionate about a few different areas. We're passionate about leadership, innovation, adoption, access. And if it's your first time tuning in, let me just sort of take a quick step back and tell you what we're really trying to get done here. So our story, our focus is on highlighting real people, real leaders that are getting stuff done. Not talking about things in theory, but are actually in the trenches, making things happen, that are truly innovating and leading within our space. And we want to give them the platform to be able to share their story and their ideas with the world and ultimately with our community. So we've got an amazing action-packed year, just incredible guests. So however you're watching this, if you're watching this, if you're listening to this, wherever you are, just hit the subscribe button now so that any of the new episodes come directly to you. So our next guest, today's guest actually is Anthony DeSena. He is the CEO and co-founder of Pax Health. So fascinating journey began in Brooklyn as a licensed physical therapist where he turned a single clinic into a multi-state rehabilitation platform powerhouse that grew into one of the Northeast's most recognizable names in rehab care. As the COO and Chief Development Officer, he steered growth, led integrations, and navigated the complexity of private equity investment through a successful exit to a hospital system. So in 24, Anthony took on a new challenge. He oversaw the formation of Pax Health through the merger of three behavioral health organizations supported by PE. So the vision's bold: create one of the largest behavioral health platforms in the region while opening the door for communities that are too often left behind. Medicaid patients, injured workers, and underserved populations. So what defines Anthony, and you'll find out more about this today, it's more than just scale. He's deeply focused on building culture, promoting unity, and keeping teams aligned around a very clear sense of purpose. So he's got a gift for leading change, guiding people through new ventures, through uncertainty, new structures, and ways that kind of help them not just adapt, but thrive. So he brings the grit of an operator, the perspective of a strategist. So his work at Pax Health really reflects ambition, empathy, and he continues to shape the future of healthcare. We're going to dig into this quite a bit today, how he is expanding access, how he's reinforcing values and leading with conviction. So, Anthony, great to see you. Welcome to the show.
Well, thanks for having me on, and you nailed the intro. I mean, you got my whole story, so that was great. Thank you for that.
We try to do some good work here. So
Good.
let's maybe start out. I want to start where it all began.
Yeah,
In Brooklyn,
yeah,
before the boardrooms, before the deals. It was just you. A clinic in Brooklyn, patients walking through the door. Paint
yeah,
the picture. Of the first. Those early days. What did it look and feel like?
yeah. It's funny, right? Because I say it all the time, like going to PT school and getting out of PT school. I did not know what private equity was. I did not know what EBITDA was. I didn't know any of these things, right? I just wanted to do really good patient care. Luckily, my mentor in the space who founded the company that I ended up being a partner in and helping scale and then taking to the next level and ventures and all that stuff. He was really always painfully focused on good quality care, right? And
Mhm.
if you look at that story and our original locations throughout Brooklyn, we weren't in the sexiest areas of Brooklyn to be, but we were in
Right.
areas where patients really needed help. We didn't look at patients based on their insurance. We just treated people.
Mhm.
And that's something professionally, no matter what level of healthcare or industry I was working in, was always super important, right? But yeah, I mean, we treated patients, dude, 6 days a week, long shifts, and
Mhm.
we just kept building and we kept doing a better job. And doctors and hospitals and folks were just really happy with the level of care. They were getting A, results from their patients, but B, administratively, right? How they were able to get patients in so easily, how we followed up as viciously as we did, and how we did the things that we
Right.
did, right? So,
Mhm.
we had this amazing team of clinicians who were leaders, um, and everybody operated sort of symbiotically, but also brought their own edge and their own color to it. And
Yeah.
yeah, we ended up this really, really amazing company one day. We had these really 21 different locations in in all the boroughs in New York City. And then the big opportunity came to merge with a New Jersey-based company who had an incredibly dynamic leader and a vision there, and that's where it got to, right? So
Mm.
it was really fun to be part of the origin story. It was really cool to be a part of the chapter of the great expansion that went on there. Yeah, and I think again, you use the word culture, and it's a word I think that gets abused these days,
Yeah,
unfortunately. But
yeah,
if you stay true to it for what it's supposed to be, you will be successul, right? If you worry
yeah,
about your people and the patients, the rest somehow with some hard work works out.
yeah. I mean, look, you're a clinician at heart, right? But like every clinician that I've always, either worked alongside of, worked with, they have at least one patient story that they never forget. What's
Yeah.
yours? The one that sort of that shaped how you see this work of care delivery.
Yeah, it's funny. It's funny, right? I won't use names, but this individual I will never forget. We saw him for a long time, and we saw him at our Ralph Avenue location, which is still there. And he was a guy that was he was frontline. He was NYPD, right? And he was
Hmm.
with us on a workers' comp case, and being seen that way. And you start going through the motion. And look, you spend a lot of time with your patients, especially if it's somebody who's
Yeah.
been coming for over a year or 2 years, whatever it may
Hmm.
be, multiple body parts. And you start realizing that the system was a little, I don't like using the word broken, but it wasn't consistent. And you
Right.
had care driven by so many different ways, right? Like they're listening to their surgeon, they're listening to their physical
Hmm.
therapist, to the orthopedist PA, they're listening to their case manager, they're
Right.
listening to the attorney, and you're like, oh my God, like this guy just wants to get better and go back to work, right? And
Hmm.
so I remember that, right? And I remember as much physically as we were able to work on with him and get him better and get him back to work, right? He was work
Yeah.
ready again. There was just so much that was achieved by conversation there, that was able to do. And I think lesson learned there for the rest of my career, whether it be another clinician as a PT, clinicians who are employed by PAX now, or just other leaders of other industries and companies, is like the power of conversation is so high, right?
Yeah.
You pick a lot of that, and yeah, I just think there's something really interesting about that.
Yeah, I had a clinician that was very near and dear to me who always said, "Hey, the work that we're doing when I was at Hanger Clinic, so it's 80% psychology, 20% of what we're doing, with the patient." And that always
Yeah,
stuck with me. Um, I want to shift gears for a second because, you've scaled, things a few different times, and scaling it sounds sexy, but it's never clean. And there are moments where the wheels feel like they're about to come off.
yeah,
And every
yeah,
leader that I know carries scars.
yeah.
Is there like what's the mistake that you've made that still keeps you humble today?
Oh, we need more than 30 minutes for that. Made a lot of mistakes, but I think I think. You know me well enough now for a couple of years, and I think,
Hmm.
when you're a hammer, everything looks like a nail, right? Like every wall is one that
Uh-huh.
you can. And you realize that sometimes you don't need to run through it, right? Why don't you assess it, feel it out, figure out where the studs are, and just cut a nice clean hole and go through it, right? And because sometimes you will have to run through a wall. So I think of all the mistakes and all the learning points that I've made, it's assess what the challenge is, assess how high the hurdle is, whatever that hurdle may be,
Right.
right? And figure out the best way to go through it or around it or under it, or are you the right person to take it on, or should it be somebody on your team, right? So I think
Yeah.
in always being proud of the fact that I'm a doer and I get things done and I motivate people to get things done. As you get better at this game and you learn a little bit more, you think more, right? And you start
Mm.
doing more assessment and start to figure out what the right way to take that challenge on is. And I think that's the many scars that back up that story, but that's really how do I try to attack it, right? Because there are things that you just have to jump in and
Yeah.
do. But
Yeah.
if you're always doing, you're not thinking about some of the other stuff. So
Yeah, it just sounds like, you through experience, you gain wisdom and discernment. And like you said, hey, sometimes there is some sheer grit and muscle that you have to do to run through a wall. And there are moments where maybe you've gone through it and you're like, yeah, probably could have done that a little bit better. And you can kind of look back.
yeah,
Look, I mean, you've gone through this private equity investment, you've exited a hospital, and those are like really, the really high stake moments.
Yep.
What did you sort of learn about yourself as a leader, kind of going through that chapter? And I want you to sort of think about this as like, um, the deals, they always look glamorous from the
Yeah.
outside. And I would just kind of want to know, like, what's maybe one truth about that process that no one tells you until you're actually like in the room.
Yeah, I talk about it a lot about sort of life after the deal, right? And that's true if you're the buyer, if you're the seller, if you're the broker,
Hmm.
if you're, right, the chief development officer. And I think about, so it isn't always sexy, it's not always glamorous, right? Like most of the time it's not. I think there's just, I say it all the time, I've earned every one of my gray hairs, right? It's like, you're going through, it's just so much, it's a lot of work, whether it's a big deal or a small deal, sophisticated buyer or seller, it doesn't matter. It's just a lot of work. Typically too, founder-led businesses, there's a high emotional component to it, right? And
Hmm.
these are people's,
Hmm.
and sometimes you have to tell them that their baby's not that cute. And that's a hard thing to do, right? And it's hard, and they obviously get defensive about that and all the things, but sometimes it's definitely harder than it seems on press releases, right? Let's leave it at that. But I think expectation setting, truth telling,
Hmm.
and accountability are key to getting through it. I think the longer a deal goes on, the more fatigue people get, and it just because the deal is not the hard part, it's the annoying part. The hard part and the meaningful part is the integration afterwards, right? And
Hmm.
you've gone through so much deal heck that could have been avoided. People are just exhausted by the time of integration, right? And you know this, like if you're making an investment in something, it's because you underwrote it and you did
Right.
you have an idea of how you're going to scale it and get a return on your investment relatively quickly. And if you can't get out of that starting gate of integration, actually building value and creating value because you're so tired from the deal, like that just stinks for everybody, right? So I think keeping
So it's
things,
like this lingering thing that's there. Do you find that where does culture come in terms of cultural alignment with a deal? Where do you value that? How do you rank it? These are things that I mean, I've read around. Someone, I can't, don't quote me on this particular stat, but it was like 90+% of integrations, like post deal, like they go sideways, they don't go well. And I'm wondering, is
yeah,
that a cultural component? Like, where's the mishap?
I think so, right? So like I say it's fun. I'm glad you brought that up because we look at a lot of deals, a lot, right? And we're closing two tomorrow, which is awesome. We have a couple more closing this year. So we have our original three deals that we did in our legacy companies, and by the end of this year we'll have added five, maybe six more, right? Which is awesome on top of our organic growth. And I don't say that to boast. I say that to say that if you kind of stick to the guardrails, it's doable, right? You can do them
Hmm.
well, and you could have good integrations. I get on the phone. So typically, how a lot of companies do it, a banker or a broker is sending it to you. You have a person out here who's hunting deals and sourcing them for you. They're writing their initial underwriting, and then they're getting board approval and investment committee, and then the CEO meets them, right? It's like that's a lot of time that was just spent that for you to then meet that person and be like, yeah,
Yeah,
no, this doesn't work. I actually jump on the initial call because I also believe that if somebody's going through a process, they have options. And as much as I need their culture to align with mine has to align with theirs. I don't want to
right,
go through the process and then, wow, these guys are not for me. This isn't going to work. So me, and I just at this point don't believe anybody can tell the pack story as well as I can or as passionately as I can. So I like to
right.
tell that right off the
Mm.
bat, right? At that point, it feels good. Then I let the numbers guys do the numbers. They don't let me near that stuff, and that's where we go. So I think it's about to answer your question. The culture is super important. That to me is the first thing I look at. That is the most important, right? Obviously, there's so much you can learn from a sim or a deck or whatever it may be, and you
Hmm.
know on geography, network out of network, type of services, blah blah. But if you're going to get on a call, like let's see if it's even a fit for both people. And look, there's been ones that I was like, wow, I'm really hot on this deal, and and then you get on the phone, you're like, yeah, I just don't think this is it, right? Or
Yeah.
it hasn't happened vice versa yet, but I'm sure it will, right? I'm sure, and I'm
Hmm.
glad it would if it happens. So I think that's the best way to think about that.
Moving in from PT into mental health, I mean, what convinced you that that was sort of the right move for you? To talk about how, merging three behavioral health organizations, that seems like you're herding cats. Like, how did that all
Yeah.
come about?
Yeah, you know what? We were so in between PT and PAX, I had launched a consulting firm, and we were doing a lot of advisory work and M&A work, and mainly on the sell side, but some buy side stuff. And there was a lot happening in mental health, and a lot of people who wanted to go to market, and
Yeah.
I did consulting, and honestly, I just fell in love with the work clinically, the empathy of a provider. There was a lot of similarities between outpatient and outpatient mental health and outpatient physical therapy from like a business standpoint. Um, and I just realized too that sometimes things are too small to get
Hmm.
on the radar of people,
Hmm.
companies or investors, whatever it may be. So why don't we string them together? We had this amazing team of founders and doers and management and other people we knew we could bring around the room. And when sometimes someone's just like, wow, this isn't going to be easy, but it makes a lot of sense. And I
Yeah.
just felt that the team we had put together could do something really special with these three ingredients. We can make a really good soup, and we're doing that right now. So, a lot of trust from my sellers, man. I was like, look, I'm forming packs. I'm gonna acquire you. I don't have the money
Hmm.
yet, right? So these
Yeah.
people were crazy enough to sign a deal, knowing I was gonna go then shop it out, right? And we put together a great deal. We had some great industry leaders around the table who've done this a lot of
Right.
time for a long than I have. And, I brought the sort of know-how of investment and operations and what this needs to look like. And they brought the know-how of the industry in and of itself. None of this stuff, man, is like a one-man show. It can't be, right? There's
Yeah.
so many pieces to this whole thing. So
I mean, you mentioned culture a couple different times, so maybe we just kind of dig in a little bit. What's been the most unusual or unexpected way that you've reinforced culture at PAX?
yeah, it's funny. We talk about it a lot. I have an amazing leadership team, and I tell them I have the easier job because I get the all-star team, right? I have the top of the tops of the
Yeah.
tops, and what I need them to do is make their teams and their departments more like them, right? They all have to beat the
Mm.
drum the way we all do, and build the team that way. We have a couple pillars of culture, especially at the
Hmm.
leadership level for the we're a truth-telling organization, meaning like, look, whatever there is, man, like it's gonna shake out in the wash, right? And same thing if you're doing a
Yeah.
deal and doing diligence, like we just tell the truth. And sometimes that could be you're doing awesome, and sometimes that could be like, hey, I think you're floundering here a little bit. And
Hmm.
truth is key. We're performance based, right? We have goals
Hmm.
that we want to achieve. We have a number of patients we want to help. So we are definitely performance based, and we are accountable. We are an accountable group that will hold ourselves and each other and our teams accountable. And those three pillars are really the crux of what we do. And I know you've probably heard that in other organizations, and they say it,
Yeah.
and everyone's got their mission on the wall in the break room and all the things. But like we live it, we beat it, we beat
Yeah.
that
I
drum,
mean, what does
right?
that
We
look like? What
do
does that
that.
look like day to day, at a clinician
Yeah,
level? I mean,
the
what are
reason
some
it's
stories around?
more difficult, and I'll say this, man, is like you asked me about what I wish I would have thought of sooner. We're 80% telehealth. So this isn't like me or my old partners or any of the leaders like swinging by an office and saying hello. This isn't me treating a patient but observing what's
Mm.
going on. Like, it's
Yeah.
different, right? To be on that. So look, we make concerted efforts to be together a
Are
lot,
there
right?
any
And
aspects of brick and mortar for the business, or is it
yeah,
fully?
we have locations, New York, New Jersey, Pennsylvania. We're
Hmm.
seeing patients in 42 different brick and mortar type locations. Some of those are bigger, some are smaller, but
Yeah.
majority of our care is done virtually, and it's a big change. So we do as much as we can, like virtual town halls. Then we do a few parties throughout the year to get people in and together as much as
Yeah.
we can. We just had a picnic, stuff like that. But we do everything we can from an internal messaging the standpoint, just to make sure people feel heard and felt, right? And I think the other
Mm.
difference for us, big time in the culture side, majority of the industry, right? Not just the original three that we started with. There's a lot of contractors, right? There's a lot of 1099 folks doing the work and whatever
Yeah.
it is. And some of these bigger groups out there right now, that are heavy on the mental health tech side, they don't, it's not really their clinicians, right? They're pretty much connecting a patient in need to a provider who can serve them, and they act as that liaison. We've gone the route of employing as many of our providers as we can, right? So I'm happy to say about 70%, and that number is rising dramatically, work for Pax Health, right? They're proud to fly the flag, they're proud to wear the logo, right? Like
Right.
we've created a place where people belong. They created a place where oh wow, I don't have to do 5 hours a week for 10 different
Yeah.
companies. I own here. And it's that's the really important part of it. And I think we've done a killer job of that. I have to give so much credit to my human resources, people and culture department, man. They just crush it, and they do a really good job of that. Obviously, I'm a pretty vocal guy, as you know. I believe in what we're doing here, but it was a struggle that it's really bearing fruit right now. I mean, we're getting
Hmm.
so many referrals for other providers who want to join. I mean,
Yeah.
we have benefits, we have 401(k), we have all the cool things that a real
It's
company
like
has.
what do providers really want? One thing I can tell you is things that aren't going to change is providers want to work in an environment where they feel valued, where they feel like they actually have a pathway to win. There's
Yes.
nothing more demoralizing than working in an organization where you feel like you're playing a game that's not winnable. And
Yeah.
it's
Yeah.
like, hey, I'm just this cog in a wheel. But if you can create something where they feel like they're actually winning, it's much easier said than done. But I'd just be curious to see how do you help the clinicians feel like they're winning? Obviously, they're helping their patients, but what else does that look like, from a cultural perspective?
Yeah, yeah, and I'll nod, nod my hat to my clinical leadership team here and what they do. I think the team does a really good job of like driving the mission. Why the hell are we doing this, right? And like, why is this so important? Why do we care so much about injured workers and getting them back to work? And the reality is because I treated these people for almost 20 years and nobody really thought about the mental health component of it, right? And
Mm,
we all know that mental health, physical health, they go well in each other. I think we do a good job of like the stakes are really high here, right? If we don't do a good job, people can't go back to work and provide for their family. I think, or it could be much more disastrous than that. It happens all the time, right? Unfortunately. So the reality is like you're not just this cog that's like, okay, so my patient minimum for the day, check, right? Like you're actually having an impact not only on the company, but also on these people. And I think when people are sort of stuck in the rat race a little bit and they're working for
yeah.
15 different companies, it's really hard to feel that and know that, right? And then you're
Hmm.
typically at that point, you're not involved in like, we have state level leadership and then regional level leadership clinically. Like you're not really part of a team as much, right? And I think we've done a really good
Right.
job building a team who wants to win the game.
Yeah, that's right. Maybe we zoom out for a minute because behavioral
Yeah,
health it's changing so fast.
sure.
Where do you, in the seat that you're in, how far do you look out? Where do you see it going? And, what role do you see PAX playing?
Yeah, I say it all the time. I mean, I hope I'm in this seat until I plan on being in this seat until the investors scrape me out of here, right? And they don't want me anymore. But I think we've done a really good job. I think we've done something really hard in bringing three cultures together while building a new one. And that's really essentially going to end up being seven cultures while building PAX as its own within 2 years. Like, so I could wow you right now with EBITDA growth and revenue growth and visit. That doesn't matter, right? Like we built a thing that is highly sustainable and highly scalable, and that's going to keep growing. So I'm excited for all the front end lift that we did, and we did a lot of it, and we're still doing some of it.
Yeah, yeah.
Like I'm excited to see that it'll never be on autopilot, but I'm excited to see those systems work because you
Yeah.
spend so much time building a system, right? So look, partnerships that we're striking right now, the need that we're hearing in the industries and where it's going, I don't see why we can't be one of the biggest players in the nation. And
Mm,
I don't see why, and especially with employers and injured workers, why we won't be the number one in the country. I just don't see why. And I don't mean that out of arrogance. I mean that out of like, yeah, we're onto something here. We're doing good work. The work we do keeps providers engaged, which
right.
is really helpful, right? Even in PT or anywhere, if you orthopedics, like if you really like the cases you have, like you're really into it, right? Anybody who's a provider, at some point in their life was a nerd about this stuff, right? They couldn't get
Yeah.
enough of it. They could research enough, and like to rekindle that in people is really cool.
Hmm.
And obviously I'm not a clinician in this world, so I don't have direct patient care, but I have the privilege every day of creating an environment where more people can do more of that. And that's the thing that makes
Mm.
that's my win.
Mm. What about innovation? Where do you see innovation playing a role as you scale? How does the organization view it? Is it sort of an embedded value that you sort of allow clinicians at the front line to innovate? Share a little bit about that if you possibly can.
Yeah, I mean we do a lot of listening to our team and to our staff, and we
Yeah.
encourage it. Not like a suggestion box. I wish we had, vanilla creamer in the coffee room sort of stuff, but like really like
Yeah.
what excites you about PAX? What frustrates you about PAX? How can PAX be better? You're out there talking to patients, you're out there talking to referral sources, you're out there talking to case managers. What are we missing, right? As we're sitting here thinking about board decks and acquisitions and enterprise value and how we can help more people and how do we cross state lines and all that stuff, like what is
Hmm.
the stuff you're hearing and how can we be better at that, right? And I think
Mm.
one of the pillars clinically that we're built on is patient access, getting people in quickly, and hopefully getting them returned to work safely is in an efficient manner. So there's a big place for tech in that, right? And tech is like the new thing. Our tech stack is being developed very nicely right now. Um, and I'm excited to see what happens from the patient journey perspective once we get that part right.
Yeah.
It's Look, we also have incredible investors who allowed me enough rope to hang myself with to get to a point where we were able to build the culture first. So we
Yeah.
grew in our first year, but the growth wasn't the focus. The integration, culture building, that was our focus, and that made for really, really strong growth in year two, right? And how we got there. So ultimately, that's what's really important. So now that part's right, the culture's right. We know we have good clinicians. Referral
Yeah.
sources are happy. Let's get it more streamlined. Let's make the patient journey better, and let's get more people in the door so we can help more.
Amazing. All right, let's transition into something a little bit lighter. We covered some heavy stuff there. Let's lighten it up a little bit. Let's do some quick fire. So first
Yeah,
thing that comes to your mind, no overthinking. You're a morning person or a night owl?
morning person.
All right. Favorite New York City pizza spot?
Ooh, L&B Spumoni Gardens in Brooklyn.
Oh yeah. Yeah, the upside down. Can't beat it. All right, what's more stressful, a board meeting or the New York City subway at rush hour?
New York City subway rush hour. Can't do it. I actually like board. We have a good board. So
Book that changed how you lead.
booked. I'm gonna go with the most recent one I've read. It's called Life is Sport by Dr. Jonathan
Mm,
Fader. Really, really good book. So
okay.
big
And
fan.
if PAX had a theme song, what would it be?
Pax had a theme song. What would it be? That's a really good question. I gotta think about that a little bit. We are a rambunctious group, a group of doers. I'm gonna say I don't know if it's a theme song, but if it was our entrance song, right? Like us
Yeah, yeah,
walking to the
yeah,
room
yeah, yeah, yeah.
statement. I'm gonna go Welcome to the Jungle, Guns N' Roses, right? We are excitable
Yeah.
about what we do. Yeah.
Amazing. And then just lastly, I think how can people follow Pax Health? Give us a little bit of sort of where we can follow your work, the journey, give
Yeah,
us a little
yeah.
commercial.
Website paxhealth.net. That is in transition. Our new site will be launched relatively soon. It's looking really good. We're really excited about it. It's not just the look, it's functionality. So again, going back to that patient journey, follow us on our socials of Pax Health on Instagram, Facebook, LinkedIn. If you're more on the business side, we try to do a lot on LinkedIn. I try to get on there as much as I can. We're investing a lot of my time and stuff into having more good LinkedIn content from that side. Keep an eye out. We're doing a lot of great partnerships, so you're going to see a lot of press releases coming out soon. Yeah, I think those are the best ways to find us, and we're building out an awesome outreach team right now. So something that worked for us quite well in PT, is being part of the community. So you're going to
Right.
start our signs popping up and our names on little kids little league t-shirts and things of that nature and golf outings, and we're getting it out there where the people know that the PAX brand exists and who we are and what we do.
Awesome. Amazing. So we'll make sure we put that link in the description. So for those, if you've tuned in, if you're listening right now, um, I want you to take one thing from this conversation. This was very apparent to me is that growth and success, they're not just measured by deals or expansion. They're measured by the lives that are changed because you stay true to your values. And it's Anthony, it's very clear to me that your focus has been on, hey, if we're going to build a skyscraper, we need to have a really strong foundation, one that runs deep and is solid. So to go back kind of to your world, your team, your company, your relationships, you know, I want you to think about the culture that you're creating, the purpose that you're reinforcing and the access that you're making possible. So if today's conversation moved you in some way or challenged you or made you think differently, then, would you mind sharing it? Give us a like, give us a comment. And look, we want to have the best people come onto the show. There's no question. So if there's a topic that you want us to explore or a leader that you want to hear from, drop me a note, leave a comment. I do read them. So again, this platform, it's not just about content. It is about community. So keep listening, keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show. Anthony, great to see you, man. Thanks for joining again.
For having me.